The urologic cancer team at the Smith Institute for Urology at Lenox Hill are experts at the treatment of bladder cancer. Bladder cancer affects both men and women. Some bladder cancers are what we call low grade. They're very unlikely to spread, and we can spare the bladder, preserve the bladder, and perform small procedures to remove the tumors as they may arise. Typically, we can manage this non-muscle invasive bladder cancer through transurethral resection of the bladder tumor. These are procedures performed through the urethra, and the tumors are simply scraped off of the bladder. Sometimes this treatment is also associated with BCG, which is a form of immunotherapy, washes of the bladder, typically once a week for 6 weeks. Other times, chemotherapy is administered into the bladder, also once a week for 6 weeks. Unlike systemic chemotherapy in the way that most people think of it, the bladder washes of chemotherapy are not associated with severe side effects. For other patients, bladder cancer can be high grade and can invade into the muscle wall of the bladder. Most of these patients need chemotherapy followed by bladder removal. At the Smith Institute, we're pioneers in robotic radical cystectomy. This is an operation in which the entire bladder is removed robotically through small incisions. Once the bladder is removed, the urine still needs to get out of the body, and we perform a reconstruction to make that happen. There are 3 different ways to do this. They involve the use of intestine. In one case, we use a small piece of intestine to channel the urine to a stoma on the abdominal wall. That's called an ileal conduit. An alternative to the ileal conduit is an orthotopic neobladder. This is a reconstruction where we use 60 to 90 centimeters of intestine. We refashion it into a pouch, almost like a baseball, and then that pouch is connected to the urethra. This pouch allows you to store urine internally and then void the urine out through the urethra. A third option for reconstruction is a continent cutaneous diversion. With this technique, we also use a segment of small intestine and we create a pouch. Unlike an orthotopic neobladder, where that pouch is connected to your urethra, through the continent cutaneous diversion, the pouch is connected up to the belly button. The patient then uses a small catheter, roughly every 4 hours, which is introduced into that channel to drain the urine. At the Smith Institute for Urology, we've been performing robotic cystectomy, bladder removal, since 2006. We're experts at all of the reconstructive techniques, and we do them all intracorporeally. This means that all of that intestinal work and reconstruction is performed within the body with robotic surgery, where some centers continue to make a large incision and do that work through traditional open surgical techniques. If you or your loved one have bladder cancer, whether it's a new diagnosis or something you've been dealing with for years, whether it's superficial, muscle invasive, low grade or high grade, our world-class team at the Smith Institute for Urology in Northwell, our urologists, our medical oncologists, and our radiation oncologists are here to provide world-class care.